gotcha.
pretty young people.
Yeah,
Gotcha.
I'm in the process
Yeah,
of
They've
I-
already
right now.
signed and
Well, I
said,
had
yeah.
one.
It's interesting, they think it's not a community.
Two weeks ago.
You know, everything we've ever done in our
I'm going by,
commission,
you know.
all interest
Well, I went
committee
last spring,
funds,
and
goes
they-
right
Okay,
back to
I
the
appreciate
community.
it.
And there's
That's it. He took a look today, he's
on
everything's
that,
good.
dealing with highway.
Do you,
The Constitution
You want to, or do you want to leave the alone? That's when you correct me out.
shall exclusively go for
Twice a day I brush him.
and
Yeah,
Right, I know where you mean.
well, yeah.
where interest was
What I
generated
did,
from the
years ago, I took, I think it was an old wooden arrow.
do that.
Oh my God. I remember snow hit October 15th. We had 2 weeks left.
Good, how are you?
You're brave. You know, I'm a warrior. I know you can take
I know, couldn't see.
what I like is
Excuse me, if the extraordinarily handsome man in the running suit would go sit down.
We're not done talking.
Because they were good.
which ones are you handling?
Oh, yeah.
Because we're going to have a meeting here momentarily.
Oh, I can't.
Hanging in there?
to get the doctor to look at it.
But I can stick with
How many tasers we get for this?
good idea, I would never thought that.
I put quite a bit on, you know. so I
All
can-
right, good evening, everyone. I will call the Wednesday, October 1st Public Health and Safety Meeting to order. If we could all please rise for the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call, please, Jackie.
Commissioner Lathrop,
Here.
Imagine.
Lemcool,
Here.
Wheelock,
He's not here yet.
Thomas,
Yeah, he's here.
Inman,
I'm here.
Rennie, Chairman Maxbauer.
Here. Next on the agenda is the approval of our September 3rd minutes. Moved by Commissioner Thomas, supported by Commissioner Rennie. Discussion? All those in favor say aye.
Aye.
Opposed, same. Motion carries. This is our first opportunity for public comment. Jackie, if you would read the rules, please.
Any person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provision of the Michigan Open Meetings Act. Comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, but shall not exceed 3 minutes. The chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4 Order of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
At this time, is anyone in the public wishing to make public comment? Seeing none, we will move on to the approval of the agenda. Are there any additions, deletions to this evening's agenda?
We have no additions.
All right.
Madam Chairman, I'll make a motion to approve the agenda as presented.
Is there support? Supported by Dr. Lathrop. Discussion? All those in favor say aye. Aye. Opposed, same. Motion carries. Next on our agenda is the consent calendar. Jackie, it's your turn again.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval is approved by a single committee action adopting the consent calendar. A, receive and file. 1, Commission on Aging Monthly Report for August. B, approval. 1, acceptance of RAP grant.
All right.
Yes, that's it. Huh?
Does anyone in the audience wish to pull any item from the consent calendar? Any commissioners or staff? I would entertain a motion to accept the consent calendar as presented. Moved by Commissioner Rennie, supported by Dr. Lathrop. Discussion? All those in favor say aye. Aye. Opposed, same. Motion carries. We have no special orders of business. We have no items removed from the consent calendar. Moving on to department and other action items. Commission on Aging, revised fund balance policy. Georgia.
Georgia Durga, Director, Grand Traverse County Commission on Aging. I am here tonight to request a change or an amendment to our fund balance policy. Last year, we came to you and asked to raise our limit so that we could put some money aside, but after much discussion from the county board, our board, and then in an effort to try and decrease our wait list, we want to spend that fund balance to serve those people on our wait list. So we revised our policy to be the same as the county fund balance policy, which is an 18 to 20% range with a not to drop below 15%. So we're asking for approval to amend our fund balance policy.
Madam Chairman, I'll make a motion to approve the recommendation for the fund balance policy as presented.
Second.
Moved by Commissioner Inman, supported by Commissioner Rennie. Further discussion? All those in favor say aye.
Aye.
Opposed, same. Motion carries.
Thank you.
And thank you.
Next, we have Senior Center Network Database Tracking System expansion. And here comes Ms. Wells.
I see she was written up in the
Evening, I
business.
suppose it is. What's
You were
that?
Written up in the business news.
Oh, that's right. Yes,
Yeah.
I'm a published
Nice
author now.
Yeah.
Thank you. Lori Wells, Deputy Director, Commission on Aging, Senior Center Network. I believe you have in your package just requesting permission to spend money that we have budgeted to upgrade our data tracking system. 7 or 8 years ago, the Commission on Aging provided us with a grant to put in electronic tracking, so seniors are given a scan card like most of us get from Speedway and health clubs and all that good stuff. They just scan their card and it tracks their attendance. We're able to leave messages for them, keep notes in their profiles so we can keep up with who they are, what they've done, so on. And it allows us to have amazing attendance data that we can keep track of. And so what we're wanting to do now is put those same systems in our outreach locations. And so we've asked for your permission to spend the money
Motion
to do that.
approve.
Second.
Moved by Commissioner Lemkool, supported by Commissioner Rennie, to approve the Senior Center Network Database Tracking System expansion. Discussion? All those in favor say aye. Aye. Opposed, same. Motion carries.
Thank you very much.
Thank you.
All right. Next on our agenda is Health Department, Northern Michigan Public Health Alliance.
Good evening, Wendy Truitt, Health Officer, Grand Traverse County Health Department.
And I'm Jane Sunmacher from the Health Department in Northwest Michigan.
And we're here tonight to present a memorandum of Northern Michigan Public Health Alliance Memorandum of Understanding. For the past year, health officers and Board of Health, in our case, Chairman Lemkool, have been meeting together quarterly to look at ways to partner, to create more efficiencies, save money, maximize our assets, increase the capacity, and also to look at ways that we can together go after different grants that the state might now be releasing on a regional basis. This memorandum would allow us to join forces but not actually become like a regional health department. We still remain our individual entities, but this opens the door for us to apply for grants. As the state has created the prosperity regions, it allows us to apply for those grants. Trying to think of how it's set up. So the 6 health departments, there might be one grant we decide that we're interested in, but not every single health department has to participate in that grant. So you can opt out if it's something that doesn't benefit or you don't need in your community. You want to talk a little?
Well, the Memorandum of Understanding is based on a similar document for what's called the San Luis Valley Community Health Partnership in Colorado. And we're part of a project that's funded by the Robert Wood Johnson Foundation, and the Colorado project also is. So we really modeled this memorandum of understanding on theirs. It's been very successful for them. It has been reviewed by 3 attorneys, so including yours. And what it really it doesn't obligate any of the health department partners to do anything, but it is a formal agreement that will work together when it makes sense. And there's as Wendy said, we've been meeting quarterly for a while now, and we've just identified lots and lots of ways that we can work together and be more efficient. And just as over the course of kind of coalescing these 6 health departments, we've already applied for 4 big grants, and they're in the hopper right now, and hopefully at least one of them will come through. I'm pretty optimistic that they'll all come through, as a matter of fact.
Dr. Lathrop?
This looks good, but I always wonder about the possible downside of it. Are we giving up any of our autonomy by, will this board have any power over decisions we make or over decisions you make?
I don't think so, and if there's grants that we're interested in, I can come and present them to you, so you're aware of.
This is just for grants, it's no other reason?
Oh, no, it has lots of different reasons. For example, you know, we all have very limited resources for public education or marketing. And together, you know, we share a lot of the same media markets. Together we could work together and come up with, you know, a really good campaign instead of everybody doing just little bits and pieces here and there. We've looked at workforce development, where we could share those positions that are really hard to fill for, like an epidemiologist, for example. You know, one health department can't support an epidemiologist, but maybe 2 or 3 could. And the other big piece is planning. The regional planning can really help us to make some differences in our communities by working together on top priorities.
So we won't, our board right now has power over our health department. Are we giving up any of that power by doing this?
All right.
No, I actually should add, this is kind of an agreement that allows us to remain as individual entities and not become a regional health department, because none of us are interested in becoming a regional health department. So it kind of protects our interests.
Commissioner Lemkool.
I'd like to make a motion to approve the memorandum of understanding, and then after that, I have a comment.
Second.
And this will be for immediate approval?
Yes.
All right. And your comment?
As being part of this organization and getting together on a quarterly basis, it's interesting to me the differences in services that are being provided throughout our whole northern Michigan. We provide a lot more services than some, and we don't provide as many as others. So I think this has been a great opportunity to bring all these organizations together. There's District 10, the Health Department, and District 2, District 4, and the Health Department of Northwest Michigan, the Grand Traverse County Health Department, Benzie-Leonard District Health Department. All those organizations have come together to talk about differences and commonalities, and then how can we figure out how to work better together, not as individual entities, but to be able to figure out how to provide the services that our community desperately needs. Our health is not always that great, especially when we do our health assessment. We're better than some and not as good as most. So I think it's one of those things we have to continue to work toward. And this is a great opportunity by this memorandum of understanding to be able to make this go forward. So it's been great to be able to work with this group, to see the work that can be done and that should be done in our communities.
Commissioner Rennie.
Yeah, Wendy, a couple questions. This kind of overlaps our prosperity region. Why do you feel that's the case with respect to the regional prosperity, Region 2? This goes to,
Can you clarify, what do you mean by overlap?
our governor is pushing regional prosperity zones.
Right.
Initiatives. This memorandum here goes over those borders.
It goes over the borders because of the way these other health departments are set up. So District 10 is actually 10 counties. And so I think there's 4 or 5 counties that fall into Prosperity Region 2 out of that district. And so I think what I've heard throughout the state is there's like 86 different kinds of regions. There's all these different programs, there's mental health, public health.
It's actually unbelievable.
Hospital. Yeah, and so they don't all exactly match up. And I think this covers our Prosperity Region 2. But there might be some additional counties that...
Well, another factor is that we all got organized, and then the governor's office issued the prosperity.
Got it.
We've regionally been working on maternal child health, kind of a regional network, because...
For a while.
Yeah, because of, actually partly because of Munson's here and a lot of the other hospitals in the northern Michigan region aren't birthing hospitals anymore. So moms are traveling 2 to 4 hours to give birth. So we've already been looking at a lot of those issues for years. This is just sort of an expansion of that.
Another quick comment, interestingly enough, we're pushing this collectivity thing in every aspect. And I'd like you to comment on the collectivity and those applications for grants. I was at a meeting last night that basically said if there is no collectivity or a purpose to show collectivity, the grants won't even be looked at for approval. So it's a very important thing to be collaborative now, and I think this is an outstanding idea.
So, also, I think it's important to note that Benzie and Leonal do not have a health director at this point. So there's been some discussion as to should we merge or should we put that? And Wendy's gone, it's not in our best interest. So I respect Wendy's point of view on that, that says that may not be the best interest for our health department to bring those two back into us, because they do not provide the services that we are. And so all of a sudden, we try bringing that together, and they go, well, how come you're not giving us the services that you're giving your own community? So that creates but that's part of the dialogue that's been happening to determine whether or not it's feasible, not feasible, so whether or not they contract with another health department to provide those services, all that kind of stuff is into play with what's happening there.
Yeah,
so there's more that meets the eye there.
There's a subcommittee that formed out of this particular project, and actually we got additional funding from Robert Wood Johnson to do a study with Benzie and Leland on their commissioners, and Herb and I have been to some of those meetings, and I don't think we're quite to the process yet where they're for sure what they're going to do, but they are developing an RFP.
Yeah, well, they're developing an RFP, and the state health department actually entertained a request for another $50,000 to help the parent health department transition, and we're just waiting for final approval on that. Actually, it's supposed to be here by the end of the week.
Commissioner Wheelock.
Well, I've been probably a little more outspoken than most in regard to this regionalization and collaboration. It all sounds really good, but historically I've seen an awful lot of situations in the last few years where we've tried to regionalize and the services that are provided to our community have diminished. We're paying as much money or more money than we ever spent before, and our services to our community is less. And I get very nervous anytime we talk about this regionalization. Everybody gets big into, well, we need to regionalize and we're going to, collaborate better. But the bottom line is I can show you dozens of situations in our own community where we've tried to collaborate and the services to our community is less. And therefore I'm very concerned about all of these regionalizations, because I can show you dozens of situations where it truly doesn't work for our community.
That exactly is the concern of the health officers and I think the board members, which is why we decided to go this route to protect our individual interests, allow us to choose which projects or which things made sense for us to participate in, but does not obligate us to become a regional. I know I have no interest in Grand Traverse County becoming a regional health department. a big region. It would just, the services that have to be delivered locally, not 4 counties away, so.
All right. Commissioner Rennie?
We may not like this regionalization collectivity thing, but it's coming down from the governor of this state. And the incentive is going to be money. And if you don't follow along with us, you're not going to be able to apply and receive these grants. We depend on them heavily. We have to face what this is. Whether it's good or bad, if we think our services diminish, let's make them better.
All right. We have a motion on the floor. All those in favor say aye.
Aye.
Sorry. Commissioner
Have to have a
Thomas?
roll call on the immediate approval?
Yeah, immediate approval.
Immediate approval, you have to.
All right. Roll call, please.
Commissioner Lemkool,
Yes.
Wheelock, Thomas,
Yep.
Inman,
Yes.
Rennie,
Yes.
Lathrop,
Yep.
Chairman Max Bauer.
Yes. All right.
I actually have the document before, so that everything's already signed.
So-
And I could ask for her signature.
I think I signed it in here.
You signed the one I provided to you.
Let's sign it and get
Appreciate it.
immediate approval.
Next on our agenda, Traverse Health Clinic, DBA, Grand Traverse Regional Healthcare Coalition Services Agreement, Amendment Number 1, also for immediate approval.
Kind of. It's okay. I need your help on this one, Dean. All right. This is an amendment to a pretty long existing contract that we've had with Grand Traverse, or Traverse Health Clinic. And Dean's going to have to explain the financial portion to you.
Okay. And Wendy is correct. We have done this transfer to the state for quite some time, and it allows us to leverage other dollars to maximize the services that we can provide. This is actually the final payment that we will make under that arrangement, and it's slightly less than, well, it's less than the payment that we have been making, so that's why we're coming back. The agreement doesn't change. What we've done all along hasn't changed. It's just a change in the amount, and this is the final payment that we will be processing this way to maximize those other dollars that we're able to dish.
Do we have a dollar amount on that payment, Dean?
Well, this payment will be $82,468.50. The quarterly payments had been $95,157 even, but this is the end of this arrangement with this payment.
Looks like I'm going to have to chair for a few minutes, you guys, so.
So motion to approve.
Second.
Okay, there's been a motion to approve in a second. Is there any discussion?
It's for immediate, by the way.
Oh, yeah.
Yes, we need
Any
immediate.
discussion? Okay, then let's do a roll call vote for immediate approval.
Commissioner Wheelock,
Yes.
Thomas,
Yep.
Inman,
Yes.
Rennie,
Yes.
Lathrop,
Yes.
Lemkool,
Yes.
and then Max Bauer.
Excused.
Okay.
Very good.
Okay. The next thing on the item would be MSUE.
Wendy, I have these things signed in here.
I know I need to check with Jackie. I just wanted to let you know, it was in the county communicator, but you can get your flu shots October 17th. But look at the last county communicator for the times. You had asked about that.
Okay, we all set to move on then? Item C, MSUE, interim director introduction.
Hi, good evening. I'm Patrick Cudney, the Associate Director for MSU Extension. I'm here this evening to talk about the transition of my position and introduce you to our new interim district coordinator. The person standing to my right is Jennifer Berkey. I know a lot of you do know Jennifer. She's a Grand Traverse County resident, been an employee of Michigan State University Extension for 17 years, that entire career here in the Grand Traverse County MSU Extension office. Starting September 1st of 2014, a month ago, I began a new appointment for our organization, serving as the Associate Director for the organization statewide. I'm in the process of transitioning between Grand Traverse County, our home, and working out of East Lansing 2 or 3 days a week and around the state. So it was a great opportunity for me. At the same time, I had asked for and received a year to fully transition my family down to East Lansing area, and also give time to continue to transition the district for MSU Extension well. And yet I'm finding that I need to spend less and less time worrying about District 3, because Jennifer is spending more and more time worrying about District 3, and she's just doing an outstanding job. So I would like to introduce, first of all, Jennifer as your new interim District 3 coordinator, and she'll be the point person and the department head for MSU Extension for the near future. Also this evening, we have with us some other Extension staff members. Dr. Duke Elsner is here, John Amrine is here, Michelle Smith, I do it every time, Jan Rappin, and Jenny McKellar, our office manager for Grand Traverse County. They've joined us this evening because we're going to be presenting our annual report. But before we get into that, I would just like to answer any questions I could for you about my transition, or offer Jennifer an opportunity to say a few words if she'd like to.
Questions first, or? Again, just Patrick nicely articulated. I've been in Extension my whole career in this county, and it's my distinct pleasure to be here and continue my service to this county. And if I can make myself available at any time for any questions or comments or any questions, I'd be glad to do that. So thank you.
What did you first come in as?
I was hired as an Extension home economist back in 1997, and my duties really revolved around helping folks learn how to better process food, which I continue to do. That as my expertise is food safety. I've always typically supervised the nutrition education staff here in this county, and that was expanded after a restructure. Pretty much any money management or any general parenting issues at that time. So we've evolved to a different title as educator with a different specialty.
I can remember when you first came on board. Welcome.
Thank you.
Just a quick question. Are you guys going to put on a new commissioner education program anytime soon?
We sure are. Every 2 years following the election cycle, we offer new county commissioner training. Those programs are scheduled. We have dates. We'll be releasing that information to existing commissioners, candidates, and others. We train, last figure, John, 82% of the county commissioners elected statewide?
It varies, but something.
Yeah, and we get a lot of repeat customers, too.
So after the first year, you're going to offer it again?
The program actually will be offered, closest to Traverse City will be Gaylord, which is normal.
Right.
And that program is first week in December.
Great. Cool. All right.
We'll have more information coming out about that. Again, we provide those training programs statewide. I'll be attending the sessions in Gaylord and in Escanaba in the Upper Peninsula.
We're allowed to come back, right? We've been through it once, we can come back again.
We get a lot of repeat customers.
Thank you.
Yeah.
It's a great service that you guys are providing for new commissioners. Highly recommend going to it.
Yeah, well, John Amrine has a tremendous amount to do with that. He and his colleagues around the state.
So, and I know Chris Kramer here is trying to put together a packet for new commissioners too, so it's a learning experience.
Sure. Well, I personally want to thank you for the time that I've enjoyed working this area is my home. I've been a resident of Grand Traverse County and for a long time, and it's bittersweet to move down to East Lansing. It's a great opportunity. At the same time, I think we're going to be spending lots of weekends driving north and coming home. But this board has been great to work with. Thank you all for your service. For the outgoing commissioners, thank you for your service on the board. It means a lot.
So I'd like to propose a resolution of thanks to you. Hopefully we can put that together and get it to you. And thank you for your service to Grand Traverse County residents. So that would be my motion to do a resolution. Okay.
All right, discussion? Charlie?
Pat, I'd just like to congratulate you on what you're doing and wish you the very, very best. And you've been outstanding for Grand Traverse County.
Thank you. It's interesting, I used to worry a lot about 9 counties, and now I worry about 83. And,
Dr. Lathrop?
I want to agree with Commissioner. Rennie, you're a first-class act, and it's going to be hard to fill your boots. I know you can do it, but we'll miss you.
That's very kind. Thank you.
Thank you.
All right. All those in favor say aye.
Aye.
Opposed, same. Motion
I
carries.
know Chris will help, will shoot me on that one, but just for no work for her. But she always does a great job on doing those resolutions. We just want to say thank you.
I appreciate that.
Appreciating what you're doing.
Yeah, thank you. Next, we'd like to move into our annual report. Every year, we provide an annual report on the scope of our services, our programs that reach Grand Traverse County citizens. We print off the copies that Jenny McKellar is handing out right now. We really do not print off too many because of the expense of printing them. But this report will be posted to our Grand Traverse County MSU Extension site tomorrow and will be available for the public's purview. Again, I've gotten over reading this to you quite some time ago, but our programs are certainly meeting their mark in Grand Traverse County. I'd encourage you to open up to the first page, inside the front cover, where you can see a text box partway down the page where it talks about our reported participants. Our numbers continue to grow in terms of Grand Traverse County citizens that participate in our programs. It starts off, it's broken down by our 4 institutes that you see highlighted throughout the report. The first is our 4-H children and youth programs with over 1,000 individuals that participate in those programs. Again, these are Grand Traverse County residents. There's 807 4-H members, and these are our traditional club enrollments. These are the 4-H clubs that operate on a year-round basis. They participate in a variety of educational projects, and there's 807 youth from the county that are enrolled in that program. We have 56 kids that participated in some short-term or special interest programs, like a one-time event. We have 211 adult volunteers that dedicate their time that make this program possible. They volunteer their time to work with those 807 youth. And there's 52 4-H clubs throughout Grand Traverse County. Next institute is our agriculture and agribusiness programs. We had 713 county residents that participated in our educational workshops in Grand Traverse County, whether these programs were held in Grand Traverse County, whether they were an online deliverable, whether it was a webinar, or whether they traveled to a neighboring county to participate in a program. There were 713 Grand Traverse County residents during the last year that participated. We have 193 individuals that participated in our community and economic development programming, or Greening Michigan is the name of that institute. Finally, and something that's unique to Grand Traverse County, is our Safe Kids North Shore programs. That's a tremendous number. That's an accurate number. 8,528 folks participated in the various programs and workshops offered in Grand Traverse County by that program. And in the back of our report, you'll see highlights of that program. And so I just like to touch on the numbers a little bit to give you an idea of the number of Grand Traverse County citizens that participate in our educational workshops. Moving into the report itself, again, just a few highlights. We start off with our Children and Youth Institute, and we talked about the numbers of kids and volunteers that serve, and you can see some narratives about the programs that they actually participated in. We have a statewide reporting program that our staff just love. It's called the Michigan Information Planning and Reporting System. And one of the extreme values of that planning and reporting system is we document where individuals, where their home, community, and county of residence are. And then we report back on those numbers. So we use that reporting system to generate these reports. So these numbers are accurate. It's done through an enrollment process. And so if you see a narrative in this report, this program served Grand Traverse County citizen or citizens. Everything in this report, there was somebody from the county that participated. And so we include in these reports that we do for our county government partners across the state information that's specific to their county. Next, if you want to move over to page 6, we have our Agriculture and Agribusiness Institute. And again, you can see the variety of programs that are that take place. A number of these do take place right in Grand Traverse County. The Northwest Michigan Orchard and Vineyard Show, Dr. Elsner, Dr. Rothwell, a number of our colleagues in Leelanau, Benzie, and Grand Traverse counties do an awful lot to put that program together, and Duke plays a key role in that as well. And over 250 people attended that program this past year. The Wine Grape Vineyard Establishment Conference, another program that Duke plays a tremendous role in. He's our regional viticulture and enologist. That's grape growing and winemaking. And again, you can read about the other programs that took place and what they were about. I know I have a limited amount of time, so I tend to do this pretty rapidly. Going to page 10, you can see samplings of our Greening Michigan Institute, or our community and economic development programs that serve Grand Traverse County. There's one in particular that I want to highlight, and it's the first program on the top of page 10. It's called the MSU Product Center for Food, Agriculture, and Bioeconomics. That is a tremendous program that we offer statewide, and we offer business counseling, business planning. We help ag entrepreneurs or agripreneurs in establishing their business. If they're thinking about starting a business, we help them vet the idea with trained, certified counselors, and oftentimes a success story is when someone doesn't start a business and make an investment that they're just not ready for. Well, as you can see, Grand Traverse County, we hosted over 123 counseling sessions that took place in Grand Traverse County, and we assisted 29 entrepreneurs. This is in the past year, in starting a new business and expanding existing businesses. 2 new ventures were launched in Grand Traverse County in the past year. And you can see examples of some of those businesses across the state. The McDonald's, the fresh apple slices that you now can get in McDonald's, started years ago. That was one of our first product center counselors, is how to incorporate fresh apple slices and help them so they don't turn brown, because kids don't like to eat brown apples. But that was one of the early clients, one of the early success stories. So in Grand Traverse County alone, we had 20 new entrepreneurs that we worked with over the past year. That's exciting. You can see examples of our Michigan Northern Counties Association, our Citizen Planner Program, our work with our sovereign nation communities. Michigan Sea Grant, we hosted the Freshwater Summit at the Haggerty Center with over 170 people attending. Mark Breederland, our Sea Grant educator, is not able to be here tonight, but this is his work. Finally, I'll close with our Health and Nutrition. No, I won't close. I'll go to our Health and Nutrition Institute. And you can see the different work that our Health and Nutrition Institute, led by Jennifer Berkey and her colleagues. And as I said, Jane and Michelle are both here this evening. And they are employed by and work with our Supplemental Nutrition Assistance Program education. That's the acronym you keep hearing about, SNAP-Ed. Last time I was here, I talked about that being held up with the Farm Bill, because it's part of the federal Farm Bill that funds that Supplemental Nutrition Assistance Program education. The population they work with are our school districts with 50% free and reduced lunch populations. They help those children and help those families learn to eat healthy with the limited resources that they have. It's a great program, has tremendous impacts, serves a large population in Grand Traverse County. And you can see we evaluate our programs to know that they're effective. Again, that's what makes Extension as a research-based organization different, is we evaluate our programs to make sure that they are successful. And you can see the statistics regarding the success for people that participate in those programs. I'll close with highlighting a couple of programs with our Safe Kids North Shore initiative. Again, this is a Grand Traverse County specific program. It does serve residents from other counties that travel in to participate. I know there's a sheriff's deputy in Leelanau County that also participates in the car seat safety checks. This is a program that serves a tremendous amount of Grand Traverse County citizens. We're very proud of it. We think you're very proud of it. Injury prevention is important. And Jen Ritter leads that program. She's a county employee. She's not able to be here tonight. But you can see in these 3 pages highlights of her work. The very last page of the report is our educator staff, our academic staff that serve Grand Traverse County in our arrangement. Again, I've encouraged you over the years not just to look at the people sitting in the local office, though this is our largest office and we have tremendous capacity here. We have lots of academic staff and educators that serve Grand Traverse County that aren't housed in Grand Traverse County. But you can see examples of their work throughout this report. I will close with that and answer any questions that I can.
Any questions? Commissioner Lemko?
Not any questions, but firsthand experience working with the youth kids as they're working through the governments to find out. I've been asked again to be able to speak to that group, second time in 2 years, and it's great to be able to see these kids find out what government is all about, not only county, but townships, but tribal nations government. And so they're really getting a great education on that. And so that's like, was it 15 weeks, I think it is, or something like that, they go through that. And so it's really good. The other thing is that, my sister-in-law, we just got her into the Master Gardener program. I cannot believe the change that she is showing because she's got confidence. And the book is about that thick. Yeah. And she has weekly classes, and she's really getting into it, and I'm very impressed with the quality of the education there. I just want to say thanks.
Thank you. We currently have 48 participants in our Master Gardener program that's being held at the Northwest Michigan Horticulture Research Station. That program runs simultaneously through distance education with Marquette. So we actually have 2 classes going on, and the instructors are either here or in Marquette, or actually out of Lansing was our last instructor. But with our distance technology, it's just like being in the classroom. It's really incredible. And so that program is currently going on, and it's at the Leelanau Horticulture Research Station.
Commissioner Wheelock.
I've been asked to, MSU Extension, as you know, has their 100-year celebration Friday afternoon, 2 to 4, I believe. at
2 to
the
4.
Civic Center. I've been asked to speak at that, and as part of the research to do that, we have found documentation that Grand Traverse County first partnered with MSU Extension in 1917. So, you know, this is a history and a partnership that's been around a long time. It's served this community very well, and I hope that it continues. You know, there's been a huge evolution over the last 5 years of what MSU Extension means to Grand Traverse County and the citizens. You know, it's no longer strictly an agriculture thing, but the idea that, you know, we've been partnering with MSU Extension on behalf of the citizens of Grand Traverse County since 1917. That's an impressive document.
So, if I remember correctly, one of the first extension offices was in our parking lot on the corner of 8th and Boardman. And it was in a building there before we had the parking lot put in there.
So do you remember 1917?
I do remember Mr. Senator McManus as part of that, and so he was a long-term extension agent for the Grand Traverse County.
In fact, that's a great segue into my last item on the agenda.
Commissioner Rennie had his hand
I
up.
was going to make a motion. Go ahead.
Go ahead.
We do have our 100-year anniversary celebration this Friday, as Commissioner Wheelock stated, from 2 to 4 p.m. at the Civic Center. At 3 o'clock, we're going to have a short program. Senator McManus, former county MSU Extension Director George McManus, is going to be there speaking, and very few people will have the history that George has or be able to articulate it as well as George will. He'll be speaking. As Commissioner Wheelock said, he's representing the Grand Traverse County Board of Commissioners speaking, and I will be there as well. We're getting great feedback. We invite you all. Would love to see you. And again, what we'll be celebrating is a resolution that I have in front of you this evening that I'd ask for your consideration. And Commissioner Wheelock did a great job of giving me that segue. In 1914, the United States Congress signed the enabling legislation that allowed the nationwide establishment of the extension system. Those were acts in May 8th and June 30th of 1914. And that was the Smith-Lever Act. What that allowed to happen was allowed the federal government and state government and county government to partner to provide research-based education to citizens to meet needs. That enabling legislation is 100 years old this year, and we're celebrating by asking boards of commissioners to pass resolutions of support across the state. We also like to localize this information, and as Commissioner Wheelock said, our partnership goes back to 1917 when Myron E. Duckles was appointed as the first county agricultural agent in Grand Traverse County. For 97 years, we've been in direct partnership with the county, where it brings federal and university resources to partner with local resources to meet its community's needs. So we're asking you if you would consider this resolution in supporting our partnership in serving Grand Traverse County citizens for the past 97 years.
Moved by Commissioner Rennie, supported by Commissioner Wheelock, to adopt the resolution commemorating 100 years of cooperative extension, a division of Michigan State University.
For immediate approval.
And I would hope that we can have the framed document for me to present to them on Friday when we do the program. Would be good.
All right. Roll call, please, Jackie.
Commissioner Thomas?
Yep.
Inman?
Yes.
Rennie?
Yes.
Lathrop?
Yes.
Lemkool?
Yes.
Wheelock?
Yes, ma'am.
Chairman Maxbauer?
Yes.
Thank you very, very much for the time and the support. If you have questions, our colleagues are here this evening, and sometimes I feel bad because I'm the talking head. They're the ones that do the work, and you see their work highlighted throughout this report. If you want specifics about any of this, please reach out to our office, and we're always there to serve. Oh.
Thank
I
you.
understand you're being a great mentor for Jennifer and Sia.
Thank you.
Thanks, Pat.
All right. Moving on. Administration.
Okay.
Mr. Benda.
You have in your packet on page 64, payment of realtor commission on the health department building. As you know, we had the old health department building on Garfield Road up on the market for a couple of years. It went through the end of June of this year, and then we signed a lease agreement with the pavilions to house the PACE program for the pavilions in that building. And as you know, the terms of that agreement, which you adopted a few months ago, basically give them free rent for about 4 years, and then in the 5th year, if we're asking them to replace the roof, and we will deduct the cost of the roof from the rent, so we probably won't see any rent for about 5 years on this. But we still have a provision in the contract that we signed with Coldwell Banker that says that we are required to pay a brokerage fee of 7%, and we argued, well, we didn't argue with them, we negotiated with them, I would say, over the fact that it actually wasn't sold on the market, and the fact that we were actually renting this to a facility that is a county facility. But we came to a meeting of the minds and came up with a $7,500 brokerage fee, which we believe, Chris Forsythe and I worked on it, and we believe it's a fair agreement.
Commissioner Lemkool.
Motion to approve.
Moved by Commissioner Lemkool, supported by Commissioner Rennie. Discussion?
Yeah, just to let you know, at the DHS meeting last week, they approved a bid for Bloxham Roofing to redo the roof.
There you go.
So I have a copy of that, so that's being taken care of.
Being happened, good.
So,
All those in favor say aye.
Aye.
Opposed, same. Motion carries. 2015 budget update. Mr. Benda.
Yes, you have in your packet a few slides. Jeez. Are you getting to this? The chambers? Everybody know?
I'm sorry, what?
You know to get into the chambers,
What the password is?
let's hope we see it. Well, while she's trying to figure that out, working from the slides in your packet, there is a estimate of our revenues and expenditures for 2015 indicate that our revenues are going up by about $732,000 over the 2014 budget, a total of $38,529,430. And our expenditures are going to, at least at a current service budget that we projected, $40 million, $314,467, which means that in order to balance this budget, we will need to use a projected use of fund balance of $1.785 million. As you know, we always utilize a plug in our budget, use of fund balance figure that represents the full employment that we budget in all the county departments. We've been using $625,000. Last year, we saved quite a bit more than that. So it's an extremely conservative figure to say that we would, our revenues need to be exactly the same as our expenditures. I think we will save the money in attrition on salaries at least to the $625,000 level. So we're really looking at $1 million deficit, much like we had last year. Only it's for different reasons. You took steps last year to change your. We went in negotiations with 3 of our employee groups plus our non-union folks, and we changed health insurance benefits. We changed a number of other employee benefits. And those yielded the desired results. We actually saved quite a bit of money as a result of those negotiations. However, our health insurance has gone up. It went up 21% last year, and it's going up another 17% this year.
Jeez.
And both of those numbers, when we pay, we're closing in on $4.5 million that we're paying for our health insurance. So you can do the math very quickly. It becomes a very large number pretty quickly. If we had not done those changes, just in health insurance alone, our bill would be $1 million higher, actually over $1 million higher. So we pretty much projected that number correctly. It's just that the cost of medical care is going up so fast, and a lot of it has to do with the type of drugs that are out there now. I mean, we have a drug that costs over $12,000 a dose that has been taken 8 different times in the past year. So those kind of things are part of our experience rating, and we don't expect that to abate soon. I think we're going to be paying those kind of dollars, but we'll see. So that's where we are, and we've got, on the revenue side, we had a pretty good, we didn't have a bad year. I mean, we had a 1.7% increase in our taxable value. That was, of course, held down because personal property taxes, so the first $40,000 of taxable value or $80,000 of true cash value of personal property taxes were given away to the businesses by the legislature, and that's great, but it did cost us some taxable value for this year. The same thing with veterans. They gave disabled veterans who are disabled and unemployable, they gave them a tax break so they don't have to pay property taxes any longer, and that contributed to the reduction in our taxable value. So we ended up with about a $200,000 increase, $217,000 increase in our taxable value. And liquor tax is going up by $233,000. That's a state revenue, and it's from the Cobo Hall convention facilities. The state did that in 1983, and they renewed it again when the bonds expired in 2003, but they immediately did another expansion at Cobo Arena, or Cobo Hall, or whatever you want to call it now. But the numbers from the liquor tax are from $1 a bottle on spirits. And that has been going up because I think people are drinking more in this state. And but half of that has to be used for substance abuse treatment. So we get a $230,000 increase here on the revenue side, but we have a $117,000 increase on the expense side for NEMSAS. It used to be NEMSAS, now it's going to go to the Northern Michigan regional entity. We had a $105,000 increase in our court revenues. We're projecting a 5% increase in the community policing officer reimbursement from the townships. We have a $25,000 revenue sharing increase instead of a $700,000 decrease, thanks to the legislature and the governor reinstating full funding for county revenue sharing this past budget season.
Dave, is that just for our portion for 2015? Is that what you're projecting?
Yeah.
And so we'll get our full amount in 2016?
We're going to get our full amount. We're going back into formula. We have about $200,000 left in our revenue sharing reserve fund. We're going to use that, and then I think in probably February, our payments from the state will start coming to make up the difference between what we don't have in.
But you only have 25,000, that's why I'm wondering.
It's 25,000 over what we had in the 2014 budget.
Oh, okay.
So we're trying to get to that number. Why did our revenue go up by $732,000? These are the big ticket items that changed our revenues. And then the 80-cent surcharge, the other half of that kicks in and adds $95,000. Still quite below what we need to fully fund 911, which is of course a non-mandated service and does not, it's one of our few things that we can, take out of our, we can't cut courts, we can't cut the jail, but public safety is where we spend all of our non-mandated funds. They're going to police officers and they go into 911. So at any rate, the $95,000 increase as a result of the 80-cent surcharge still leaves us with about $680,000 of county subsidy for 911 and central dispatch. On the expenditure side, health insurance is the 15% increase is a big part of our problem. It's almost half of the issue, $1 million issue that we've got. Our accrued liability for retirement went down because our investments were so high, but they still are making us pay double on an accelerated basis. It's going up by total $250,000. It's $175,000 just for the general fund. That's part of the general fund problem as well. There's a lot of other things going on inside the personnel costs of the general fund, but they're a net offset, including wage increases with, changes in, dollars for vacation payouts and reductions in defined contribution for new hires and things like that are offsetting some of those costs. So really, the big kick upward in personnel costs all has to do with retirement and health care. substance abuse, which is, I just talked about, tied to the liquor tax increase. We have transfers of the capital improvements fund, which I'm not going to go over tonight. You can look at that when we see the budget and see what's out there in capital improvements that needs to be funded. And then we have some offsets, and that kind of is a summary of where our general fund expenditure increase comes from, mostly from health insurance, retirement, and some capital improvements. There are some potential ways to reduce our fund balance. And let me talk a little bit about the fund balance piece, because what we have right now is we had a large increase in our fund balance last year, $1 million increase in our fund balance. We not only saved the attrition on the positions, but we saved additional dollars. I think it was because we had such a spotlight on our budget and saving. I think our departments really tightened their belts, and I think also we had a hiring freeze in place that delayed hirings, which added to our savings from turnover. Got anything else you want to add to that?
We didn't have to appropriate it 100% in some of the cases, the courts, the child care fund, and but yes, I mean, the departments on the expenditure side knew the budget situation, and most all came in under budget. We did have one additional liquor tax payment that was $300,000 on the revenue side. So
yeah, so there were some reasons for that. So our fund balance policy says that we need to have 15% of our general fund expenditures, and taking this year's fund balance and next year's $1.7 million fund balance, and assuming that we spend all of it, we are still going to be over the 15% by about $420,000. So what I'm trying to tell you is we can start working on this problem. This is not a crisis. This is something that has to be done soon, in the next year or so. And you can start to, and maybe next year we'll have a saving. At the end of this year we'll have a savings, and maybe we'll have enough more than $400,000. Most likely we'll have probably $1 million more than that, because we got, normally we expect to spend about $625 is what we put in the budget, but $750,000 is going to be attrition in positions because of the turnover that we experience and the fact that we budget full employment. And then the same thing will happen next year as well. So, we're not in that bad a shape, but we are, the revenues are just not meeting the rise in the expenditures, especially those rises that are occurring in health insurance and retirement. So there's different ways to deal with that. We could, if the 911 surcharge passes, that will be a nice fix. It will not only help us pay for the capital improvements that have been, kind of crying for our attention, but it'll also take care of the operational subsidy that we've had to put in for 911 all these years. And that'll give us about $686,000 toward offsetting that $1 million deficit. That would be a nice thing. If it does, it's not in the budget though. It's not. We're not assuming that. We need to, the voters are going to have to speak on that before we can even think about using it. We had personnel cuts outlined last year. There are several. If you want to go back, and I've got the list here if you want to talk about them, but if that list generates $793,000 if we were to do all those cuts. Pension funding bonds, we don't know the exact number because we'd have to do a new analysis to figure out what kind of savings we could generate on that. And we would really want to look at our retiree health care obligation as well. Retiree health care has not been pre-funded in this county, and it's about a $350,000 we should be putting in. Right now we're paying as we go, and that amount is in the budget, but the pre-funding part is not in the budget. And we could, we have $100,000 in non-contract retiree health care subsidy is used to offset the Medicare Advantage plan, and Jen Seaman and I and others have been working on with our broker to bid that out and see what we could come up with, and I think she's going to be coming up with a solution on that at the next meeting, at your Ways and Means Committee meeting, maybe? Yeah. Because we want to run that by the retirees before we give it to the board. And then we have, you could look at additional revenue from full cost reimbursement for community policing officers. We pay, I've got a number in here of $650,000, and that is pretty much for non-indirect costs. It doesn't pay for overhead, it doesn't pay for the buildings, it doesn't pay for a whole lot of things that, their payroll and those kind of things. That's another number. But just taking cars and taking it's really a kind of a quick and dirty number that Dean put out that takes the general fund cost of officers and says it should cost about $30,000 more than what they're, $32,000 more than they're paying. You can do that, you can slice that a couple of ways. Right now, they're not too thrilled about a 5% increase in the subsidy that we provide, or in their payment to us for community policing officers in their townships. But if they were to reimburse us for full cost, $650,000 would cover, the vehicle and, gas and weapons and markings and all those things. It wouldn't cover indirect costs. And they could either, they had three choices. They could eliminate the officer. They could take a percentage of the officer, whatever they're willing to pay, and get that much time in their townships, or they could pay it. They could pay the additional $30,000. So that's another option. My feeling is, it's not your bill. You're paying their bill for them. They want a full-time officer, they should pay for a full-time officer. I'm not going to be a popular guy for saying that, but I'm looking out for the county here. So, and there's a bunch of things that are not in the budget. There are no new positions in the budget. There's no new positions or programs, and there was about $700 and some $1,000 worth of new positions requested. There were some reclassifications requested. We don't have any money in there for a jail study, although that could probably be done this year with the sheriff's budget. I don't think it's going to be that expensive. There's no money in there for a classification study. There's no money in for retiree health care pre-funding. There's a whole bunch of money that's not in the budget. There's no money for 911 equipment, unless, of course, the surcharge passes, but then we would put it in the budget along with surcharge revenue. So that's kind of the situation we're in. Everybody's been kind of skinnied down to where, it's difficult to keep moving forward without making some serious hard choices about our budget. And I just wanted to give you a briefing tonight. We're working on trying to get the document prepared and get it out the door. One of the problems, one of our holdups has been health insurance is such a big part of this, and the numbers are just now coming in. We met with our broker on Monday. We got our Medicare Advantage information Monday. We got, and we're still waiting. I guess 5 o'clock today was the deadline for Blue Cross to get us a bid. We had asked for this to be bid out, our health insurance to be bid out, and they got responses from everybody but Blue Cross, and Blue Cross had, well, we have a problem with the numbers and blah, 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 and we gave them a hard deadline at 5 o'clock today, get it done, or you're not bidding. So that's where we are with that. We're hoping that the numbers will come down somewhat, but we're not real confident because our broker tells us our experience is high.
Commissioner Rennie.
I had a question for you, Dave. We got a memo from you concerning House Bill 5097. I want you to I like that word segue over there, cut a high use, but I'd like to segue that into what's going on here with this health insurance. Is that part of that or not?
Well, yeah. I mean, you saw. I think you all saw my email to our senator, and in a short time, I had to say a lot in a short memo to him. But it basically is, if you're changing this and exempting, Act 312 eligible groups, they can stall us for 2 years, which means that we have to pay the bills for 2 years. And if we have to pay for, if all of our, right now, if all of our unions that didn't go on the new plan last year, the ones that we got to work on this year to get them to accept the changes, the $250, $500 deductible, all those changes that we put in place, just for the health insurance plan, it'll cost us $590,000 more. Just for that group, just for the other half of our employees. And we're already saving the money on the first half. The other half is $590,000. And if we have to add, we're going to add that to our deficit. So I wanted him to understand that they can stall us, and probably it will stall us for over a year if they do stall us, and we're going to end up with a big bill that we'll have to pay. And there's not, they're basically taking our tool away from us. So we would really like them to not do that. But it being an election year and law enforcement support is very critical for a lot of elected officials, we think that this is going to pass. And so does the Michigan Municipal League and the Michigan Association of Counties and the Township Association. They're all vehemently opposed, and no one's listening. It passed with 11 votes against in the House. It's on its way to the Senate. We're pretty convinced the governor's going to sign it, but it's bad policy for us. It will mean a big difference for us.
I'm going to explain something really quickly. I am not feeling the best right now. And so occasionally you will see me hand the chair sign off to Dr. Lathrop and leave the room, and that's what I'm going to do right now.
All right. Take care of yourself.
No, I'm not leaving permanently. I just am. But if you would, for a few minutes. Thank you.
You betcha. Okay. Now what do?
I have a question.
Okay, over it.
Dave, I know this is a sensitive area, but when we talk about negotiating here next year with these various groups, these 312 groups, this could have an incredible impact on what we've been led to believe up until now.
It could. I'm not saying that it will. I mean, right now, we have been negotiating with, well, at least one group, one 312 group. And I think we've made great progress, but I don't know if this is going to change that or not. I don't know if that progress will now be, the dynamic will be changed so much that we'll find ourselves in a bad spot. The other part of this is, under 312, they now have to take into account ability to pay. And you can look at our numbers and you can see that ability to pay is going to be a factor for us. So they may be able to stall us, but to go to arbitration for this and win is going to be another matter.
But should 5097 pass, it's a different situation than if it should not with respect to leverage. Is that true?
Well, it changes leverage for sure.
Completely. I mean, this is a huge thing.
Yeah.
When will we know if it passes or not?
Next
By the end of the year.
week, maybe.
So it'll.
I mean, it went from the House to the Senate floor.
So
It
basically,
didn't stop
once
at a committee, it went straight.
Once it passes, will it change your advice to us about how we do the budget?
Probably not. I don't think it'll change, your negotiation strategy has been set, and I think we can go back and review that, but I think it's a fair negotiation strategy. I think we're trying to do the fair thing to all county employees, with all county employees, and still look at our financial situation realistically. And I think to this point, everybody's pretty much been on board with it. So I don't know that it's going to change it all that much. I think our employees will step up. I really do, because I don't think we're doing anything unfair to anyone.
Commissioner Wheelock?
Well, I think it's important to note that, this board and our staff have been very solid in our negotiation strategy. And, but one thing we have to remember is that even the 3 units that we negotiated with a year ago, those were one-year contracts. So every contract that we have, with 13 bargaining units and 2 non-contract agreements, are all eligible for renewal this year. So this House bill could have an effect, but I think the commitment that we've made to defend the strategy that we have in place, as long as we are committed to that, we should be consistent going forward from here. You know, one of the things that I'm inclined to mention in here when we talk about the community policing officers, another condition that is in that same situation, at least in my mind, not necessarily in everyone's mind, is the liaison officers at the school. I am a firm believer, and I've always contended that as long as the schools want 40-hour-a-week officers in the schools through the liaison program, they should be paying for those officers just like the townships are paying who choose to have community police officers dedicated to their community. In the past, we had an agreement where the school was paying 50% of those costs, and the school eliminated that money, that funding, and after that, we went for a short period where we did not have the officers in the school. A lot of public pressure and a lot of pressure was brought on the county and the sheriff to put those officers back in the school, but I think we have to continue to put pressure on the school. If they want dedicated officers in the school 40 hours a week, they should be making a contribution toward the cost of those officers, not unlike Garfield Township, Acme Township, Green Lake Township, all the townships that are paying money from their budget to have a dedicated officer in their community. The school should also be matching that money.
Commissioner Inman?
Just 2 points, Dave. One item is that, you know, I still believe we've got a great relationship with the bargaining units here at this county over our tenure, and they've always come to us in good faith, and I can't remember the last time that we got into such a passage that we could not agree and close and come to an agreement, not only for the benefit of the employee, but benefit of the employer. So, you know, everyone is able to at least maintain their jobs without major layoffs, because any protracted stance on behalf of the unions is just going to put more pressure on our budget and probably and potentially create more layoffs. So that's not in their best interest. So I'm hopeful that the trend will continue, that we have good relations, and the purpose behind that bill is, I guess I'd have to dig in it more, but hopefully it doesn't affect us. The other thing more importantly I want to mention to you is that I'm a big believer in, you know, promises made, promises kept. And we got into these community policing officers a long time ago when the federal government came out with these COPS dollars. And the first 3 years, there was a graduated amount in terms of sharing, and after the third year, you know, we came up with the agreement with the townships and the villages, and it was a cost sharing, and it was a way, Dave, that with the growth projections that we had for Grand Traverse County, especially over the last 10 years, that there would be a cost sharing for officer coverage between the community policing officers in the county, and that burden wouldn't fall totally on us, knowing that we were going to go through some population growth, and it did occur. We increased 10,000 people in the last 10 years, and that growth model is likely not to change. So even though, you know, Administrator 101 would tell you, look at every hole and every and under every rock, and you have and I think it's your responsibility to us to lay out even unpopular options. I think we still have to maintain our agreement with the townships and villages that we put in place for the cost sharing of officers and the program we have. I think we're a model in the state in terms of the number of officers that we have and the cost sharing that's going on in this county for protective police services. And if we had to bear the cost based on our own growth, we would be farther behind, in our budget, so, with coverage. So personally, I don't want to go back and address full cost coverage, even though I would expect you to lay that out as an option. That's an agreement that we put forward many years ago, and the program's worked well. And I think we have benefited from a county in terms of cost sharing that coverage with the growth that we've seen in the last 10 years. So, okay.
Commissioner Rennie, and then Commissioner Thomas.
Responding to Commissioner Inman, we're into a fund balance to pay for all this stuff. That encompasses all the local units of government, not those with CPOs only. So this general fund or fund balance that we're using is really a tax on all the local units when we pay for these CPOs if we are in a deficit. If we're going to go into a fund balance and use it, these local units that want a CPO should step up to the plate and do a little more for the county out of fairness to those who don't have a CPO.
Commissioner Thomas.
I think if you raise the price too much on the townships, they'll just back out. You'll lose those officers.
My response to that is if they can't justify the CPO by paying for it, they don't need it.
Well, several of them have already backed down some. Green Lake doesn't have one. Blair only has one now. And I think, I hate to say it, but I think we charge them too much. They're all going to back out.
Dave.
Well, I introduced these ideas. The department heads are they've been talking about it. I've met with them, and they've decided to put together a committee to come up with options that might be presented to the board. We're going to kind of look at those, and so we've got some time to look at, what to do, how we might address it, even if it takes into next year. I mean, it just puts it out in front of you that, we've got this structural deficit. It just keeps persisting. Now, we might get lucky at the end of the year and be able to reduce, have additional fund balance to be able to reduce, and have margin when we get to 2016. But if we don't, then when we get to 2016, we're going to have to make some tough choices, and there won't be any going any farther. We're going to have to make those tough choices then.
Commissioner Wheelock, then Dr. Lathrop.
At the end of 2013, in our 2013 budget, we had projected to spend $625,000 of fund balance. Mm-hmm. We actually, in fact, did not spend that.
Right.
Plus added back in another almost $1 million in addition. So we ended up with better than $1.5 million increase in our fund balance at the end of 2013. We again budgeted fund balance in 2014. Have we got any sort of numbers as to where we might think we're going to be? Are we at, I understand that it's always tough because there's some funds that are really screwed up, but how do we anticipate, okay, we're 3/4 of the way through the year. Are we 3/4 of the way through the money that we budgeted? Are we at 60%? I'm just asking if we have any idea, because, if in fact we don't spend the fund balance again this year, and we actually grow the fund balance again, it's kind of a mute discussion, because if we budget the money and we don't spend it, it's right. not such an issue. If we're going to dig into the fund balance and we're going to have to spend the fund balance, then it is more of an issue. But, if it's just a matter of putting the numbers on paper in order to make the budget balance, and we in fact are not going to spend that fund balance money that's budgeted, then, we can sit here and beat ourselves up. We unfortunately, it ended up last year, we went through the entire process, crying wolf pretty hard that we were going to be short $1 million. And at the end of the year, we added $1.5 million back into our fund balance.
Wow.
So.
$1 million.
Dean, you want to
All eyes
comment
are on
on
Dean.
your...
You know, and-
Pull your crystal ball
Well,
out for
I-
Sonny?
You know, the use of fund balance and increasing use of fund balance should concern all of us. Absolutely. Because 2013, I brought back that analysis for Ways and Means probably in March. We simply, Dave wanted me to do that projection. I have not had time. I can bring something back for Ways and Means. We're all spread kind of thin right now on a lot of different projects, and that is something that Dave asked. No, Commissioner, I'm not going to tell you that we're not going to use the 1.587 that we have in the 2014 budget. I think you're going to use some of that fund balance, but it would be in our best interest to try to do that projection and take but you don't do that in 20 minutes. That's a 3-4 hour, analysis that should be done, and I'm not going to say one way or the other without doing that analysis.
Okay.
Dr. Lathrop, then Commissioner Rennie?
Yeah, I was kind of confused about that too. We said we'd take $1 million out of fund balance and spend it, and did we?
Well, we haven't gotten there yet.
So how much time do we have before we'll know that?
Well, until Dean gets this,
No, I'm not
basically, you have to reproject the budget. You have to go through the whole budget process
Yeah.
where you take all the positions that are right now on staff, run them, through the end of the year, add it to what's been spent so far, and come up with another projection of where we're going to end up, which would take out all the attrition, would take out, money, and you got to go through each line item in the budget and decide where it's going to end up at the end of the year. Some things are, right on the month. Some things are 2 months behind. Some things are a month behind. Some things are paid quarterly. I mean, you have to know all those things, and you have to look at every line. So in order to do an accurate projection of the fund balance, of where you're going to end up in the third quarter for the end of the year, you got to really redo the budget. And we just don't have, in Dean's defense, he doesn't have the staff to do that. We're working on this budget, and to reproject that budget, of the 2014 budget, I mean, we know it's not going to be over. We can't tell you how much it's going to be under.
What's weird, though, is that here we are looking at asking to do another 1.7 out of the fund balance coming up, and we don't even know if we spent the fund balance that...
In 1.5?
Yeah, we don't know.
That's right. But what I'm telling you is, if we put this in and adopt this budget, you have the luxury of time to fix it if there's a problem. All right, so if we get to the end of the year and it turns out that we didn't spend as much as we thought and we have a whole bunch of extra fund balance, you don't have a lot to worry about, at least for another year. We are going to, obviously, I think we need to trim it close. If we're too conservative on revenue projections or too conservative on our expenditures, we need to figure out where we're too conservative and put realistic numbers in. We looked through the budget, both of us looked through the line items in the budget, and we couldn't find where we were too conservative. There's not a lot of, we expect that it's going to turn out this way. The numbers that we projected for our current services numbers, we expect that it's going to turn out that way. And some of them can go haywire on you. Child care fund, you just add one more kid to state wards. You got one kid who's a really bad apple that needs to be put away into to be educated and incarcerated at the same time. It costs it costs less for a Harvard education than to send one kid away. So it can blow your budget out like that. So when you're off by $1 million in a $40 million budget, yeah, it's off. It's not that far off, though, because you could lose that in 2 kids.
Okay, I'm not being critical. I'm just trying to have you educate me.
No,
one of the things that concerns me is you said that in 2016 we're going to be facing the monster. There's no getting away. Why don't we face it now?
You could.
Why do we wait until we have to? So I don't know I don't know what the answer is, but let's get it over with. Let's get in good shape, make the cuts we have to make. We're gonna have to face it anyway.
Yeah, these are tough decisions.
No, we should make them, this bunch here.
And whether you're off by $1 million, if you're going to save this $1 million at the end of the year, if it turns out Dean does a reprojection and you have $1 million that you didn't think you had, you got all the courts and the clerk and the register of deeds, everybody's saying they need more imaging, hundreds of thousands of dollars. You got capital improvements that we've said, yeah, we can do this and we can do this and we can do this. We got to do that. But we can't do any of this other stuff. And we've got a bunch of that. We haven't put any money aside for roofs, parking lots, and normally you would put aside $11,000 a year for parking lots and, $10,000 a year for, roof, or $5,000 a year for a roof on this building. And then, of course, you got many other buildings. I mean, you should be putting money aside for the day that you got to replace the roof, instead of having it all come at once. So, yeah, I mean, we're not out of the woods. I mean, we have skinnied the budget back.
If we got a big fix coming, I think we ought to take it on now.
Commissioner Rennie.
We had a chance to take it on last year, and all these deficit hawks did a flip-flop and voted for a systemic budget deficit. Why didn't we do it last year? We tried. The problem is, you're mentioning this fund balance. It's always, we're using it. If this was going back every other year, it would be a different thing. We're into fund balance with no capital funds, short of equipment and necessary stuff for 911. The list goes on and on. Your $1 million usage is not really a true number. It could be $3 million if we address the problems we need to today. 911 is telling us they need $1.6 million today. So you're still hiding some of that. And it's a consistent systemic $1 million deficit. It's been going on since I've been here, and we haven't done nothing to address it. Another question. You show $175,000 for our defined benefit retirement cost increase. What is the number we're paying in total?
Point.
Well, for
2 million, 2.5 million?
No, for 2014, we're paying in $4,254,000. That goes up about $400,000 across the board. The number that Dave has on his analysis is just the general fund impact of that, so.
Because other funds get impacted.
Okay, and we looked at
whatever.
where the markets are this year with respect to last year, when we got a little bit of a break, to see what we're going to see next year. Markets are very volatile right now. Stock market right now isn't probably that much improved over your number that you used last year. What is the impact of that 8% MERS thing with respect to that on our budget?
Well, it reduced the market value to the actuarial value. The actuarial value of assets were 14% lower than the market value of the assets, because they didn't hit the 8% every year. The average was 14% less. Well, after last year's great year, it's now 6%.
Do you expect that next year, though?
No, I expected them to get closer to zero, like break even.
Okay.
Their 8% projection. And it would be consistent with, what they believe to be.
Push us into a discussion about unfunded pension and retiree benefit bonding?
Well, it's just a different way to pay for your debt. I mean, you owe this much money. It changes every year because the markets change every year, and the market value of the assets change every year. But the reality is, today you owe $40 million, or whatever the number is this year. And you can pay it the way that MERS tells you to pay it, which is pay double the actuarially required contribution every year, and continue that for so many years, and then it drops off a cliff and you don't have to pay so much anymore. Or you can finance that just like you would finance buying a house. You can take it out over 20 years. You can, pay a debt service on it, and you have $40 million debt, you give it to MERS and tell them invest it and make your 8% a year on it. And we're going to pay our 4.5% interest, and we're going to pay the same amount every year, and then 20 years will be paid off. So it's just a different way, it's a different method of financing your debt. And when you do that, by the way, you reduce your retirement cost every year, your annual payment. you're not at MERS, but, you're not subject to that rule that they've put together that says you got to pay double every year, double the amount that you should pay, because you're a closed plan. And you got to pay it off real fast, is what they're saying. You know, and the fact of the matter is that our retiree payments are $1 million something. We got to pay $4.2 million every year because we're paying double. And, you know, they want us to pay it super fast. So, you know, we're paying for people who are in their 40s right now, or 30s even. Some people who are still in the defined benefit plan and they didn't move to the defined contribution plan, we're paying for them. We're just projecting to live to 85, but we got to pay off their liability in 10 years. So it just says, to me, it makes more sense to finance the debt.
Are we not creating debt to pay for an accrued liability?
But using a pension funding bond? No, you're not creating debt. You are incurring interest payments, but you're also getting interest on the money that you've received.
Was special legislation required to allow this bonding?
Yes.
Is it going to sunset?
No. Well, at least not this year. It was going to. It was just approved.
That did get approved?
Last week? 2 weeks ago?
I did not know that.
Yeah.
Appreciate that.
They just did that. So that's a possibility, and it reduces our, we don't know exactly what the number is. I've got $700,000 in here, but we could ask for, you know, that's a lot of work too. And why bother doing all this work if nobody's interested in doing it? So we just throw it out there. It's another way of impacting your bottom line.
Commissioner Lemkool.
I think it's important to note that this is strictly a budget. It's not a spending. It is a spending plan. It's also an income plan, but doesn't always mean that we're going to meet those ideas. This is the best guess estimate that we could possibly do, and our staff is doing an outstanding job.
Thanks.
You start talking about whether or not you want to do some cuts. We got a phenomenal staff in our community, and you start reducing some of those places. The number one area is going to be police officers, because it's 50% of our budget. And I'm not sure our community wants that to happen. I think it's really important for us to be able to understand that we may have to take fund balance in order to preserve what we have, the services that we're providing for our community. It's important that we continue to do that. And we have a fund balance just for that purpose. And that fund balance is not going to go below 15%, even with a projection. So if we have to go to 15%, fine. If we have to go out and do something with the unfunded retiree benefits, then I think we have to work at that. But I think it's also one of those things that in 12 years, that's going to be paid off. In 20 years, we could pay it off too. We just extend the terms. That's all we're going to do. And maybe that's the best way to go to be able to eliminate our challenge right now to be able to continue to provide those services that the community is demanding that we give them. So I think it's important to note that budgets are strictly a best guess estimate. They're not what is realistic. In most cases, they're pretty close. So, but let's work toward making sure that we continue to provide those services.
Dr. Lathrop?
I don't know, if what Dave says is right, in 2016, we're going to have to belly up to the bar. We can talk to our community and listen to our voters and our constituents and stuff, but you can't do the impossible. If we don't have the money, we can't provide all the services. We have to provide the services that are core, and the other services, maybe we don't. Something's got to be, you're telling me that something's got to be done by 2016, different from what we're doing right now.
I'm saying that if you get past 2014 and we spend $1 million in fund balance, and then we get to 2015, at the end of 2015, if we adopt this budget the way it is, and we spend another $1 million in fund balance, then yes, you are going to have to do something.
So,
if it turns out that we spend less than $1 million in fund balance in either of those years, you'll have a little bit more flexibility in, you know, fixing your problem. But I don't know how much more that's going to be, and I'm not sure what's going to happen. I really don't. I'm just saying that structurally, Our budget is about $1 million in deficit, and it's probably more than that, as Commissioner Rennie pointed out. I mean, as I said, a whole bunch of things aren't funded. We aren't dealing with the jail. We aren't dealing with classifications. We aren't dealing with imaging systems. We aren't dealing with a whole bunch of things.
So the number's
Need to
really
be
worse
done.
than, honestly, the number's.
It really
worse.
is
Yeah.
worse.
Okay, so my point is that, yes, these services are important to our community. Of course, we want to keep the same services up. But you can't do the impossible. We're going to need to make some tough choices. You can't just wish it away.
Commissioner Rennie?
Getting back again, Dave, sorry to harp on this, but, you know, we had a very high priority for a classification study, and it has a whole lot to do with our employees, how they're treated, what their morale is, how we're going to go forward with negotiating with employees about issues that are critical to the county. And that's another area I feel really bad about, that I think we had made a promise or an indication to those folks we were going to do that. It's just right out the window again. Nothing in here again for economic development and things like that. This, what we're doing, is not addressing the issues this county faces, and we push it back year after year. We did the same thing in 14 that we experienced in 13. Now you're talking about 16, for God's sake. That's 4 or 5 years right there. We've got to get after what the problem is. Part of it is a classification plan to reorganize this and reorganize this workplace so we don't have to constantly be picking on the employees when we have a shortfall. Understand, 80% of our budget goes to wages and benefits. That's what it is. That's where you got to look. I understand that. I just don't feel we've done anywhere near enough in other areas to address this. And I feel remiss about it. And I see us going into next year with the same thing we did last year. I really feel that.
Commissioner Inman?
Well, I guess if I could reflect my feeling and perhaps take a gut guess at what the board's feeling was over the last 4 to 5 years is when we saw this coming and started seeing the realization and the decline in property values and the less revenue situation that we faced. At that time, we took more of an optimistic approach and said, okay, we have a fund balance. Let's try to ride through this economic issue and hope that it's a shorter-term recovery. And we have the flexibility because we have, at that time, a 20% fund balance. And that fund balance is technically used for ups and downs in the economic times, so you're not constantly letting people go and hiring and then letting people go and then hiring, that you've got more of a steady, flat employment situation. And we were fortunate enough to be smart enough and dedicated enough over the past 10 to 15 years to build up a fund balance so we had this flexibility, because when I first got on the board, we had about $1 million in our fund balance, and we didn't have hardly any of a bond rating. So to the credit of the previous county administrator, or county commissioners and administrators and staff, we went through some good times and did some great things, and built up our fund balance and got a bond rating, a very good top bond rating. But that being said, it was my belief, sitting here as one commissioner, that there was going to be a time where we were going to be willing to use fund balance to try to balance this out with this recovery time. And the recovery time we felt was going to be shorter in nature, and it turns out it is going to be longer in nature than we originally anticipated. And quite frankly, I see a lot of construction going on in town, both commercially and residentially. We've got revenue sharing back, which is a big plus.
Big plus.
But I still see, I don't see the assessed values for homes and commercial property and the increase coming back to the point where, like Commissioner Lathrop said, we're going to end up being faced and painted against the wall where we can't go below 15%. This whole philosophy of using fund balance was more of a shorter-term strategy over the, that the board felt that they could, stomach a 4-year process, that, hoping for the best and incrementally doing some cuts and doing some cost sharing for employees to help the cause. But the fact of the matter is, we've not seen the recovery we need to make up the differential where we were 5-6 years ago. So I guess I'm in as hard as it is, I'm in the camp of Commissioner Lathrop at this time. And then I think what Commissioner Rennie's trying to say, or has been saying, that I think that we need to do our jobs and say, this thing could go another 5 more years, and we need to start making some incremental cuts now and next year, because this recovery is not going to be what we believe it's going to be. It's going to take longer. And you're right, we've only got 1 more year left of playing around with the fund balance, and you're going to have to, the choices are going to be more difficult, because when healthcare goes up 17% and then 21%, what's it going to be the following year and the following year after that and the following year after that? So without making some kind of incremental cuts, you're never going to be able to absorb those healthcare costs. It just isn't going to happen. And we can't have enough construction and increased values and property values to cover those differentials every year. It just isn't going to happen. So I guess I'm to the point where, I could stomach some fund balance. I can stomach, some things to improve our budget, which we've done. I think we just need to go back, and it doesn't have to be all in this year, but I think incrementally, I think we need to make some cuts for the 015 budget.
All right. Commissioner Wheelock.
Well, we went through this very similar discussion a year ago right now. We brought every department in. We talked about what services we were providing and who they were serving. And I think the long and the short of it was, the assessment was, there wasn't a single service that we were providing that someone in our community wasn't depending on. But all of those services come with a cost. One of the things, and Charlie mentioned it earlier, we have to remember 80% of our budget is taken up with personnel costs, either wages or benefits. 70% of our budget goes to the courts and the sheriff's department. So the long and the short of it is, the only places we're going to find the kind of money that we got to cut here is probably coming from law enforcement. And it's real easy to sit here and say our community wants those deputies, and we need those deputies out there. But the fact is, if we truly are going to make the kind of cuts that we need to make to bring this balance and get rid of this structural deficit, we are going to have to make cuts in those departments. We've been at this a long time. I've been sitting here a while. So, since 2001, when we made the decision to get rid of the defined benefit program and go to the defined contributions, we made concessions. We offered some early outs, which, were good things and bad things about them, but they added to our legacy costs, but they gave us some immediate relief very quickly. But the fact is that, since 2001, we've grown our fund balance by $8 million. We've increased the bond rating to a AA. We're the highest rated county in the state of Michigan. We've done a lot of, well, probably not anymore, but we were, A couple AAAs. But the fact is, we've done a lot of really good things in the last 10 years. But the fact is we're at a point, you can't recycle enough paper clips to cut $1 million out of this budget, folks. We have cut every department in this county, 2% here, 3% here, 5% there, to where the only way you're going to make the significant cuts that you have to make is to eliminate personnel. And when you eliminate personnel, you're going to eliminate services to your community. Pat talked here earlier, we talked about a little bit about the evolution of MSU Extension. We all seen what that did to us, did as a community. The whole organization had to be restructured in order to get the budget to balance. I think we're at a situation where this organization is going to have to restructure in order to balance this budget. And it's tough decisions, and you're going to have to be committed to make those decisions. And they are not going to be easy, and they're not going to be popular.
Dr. Lathrop.
I'm speaking for myself. I'm not smart enough to do that. Maybe we should consider bringing in an outside group that can look at the county, has done this professionally, and advise us where we make the cuts. And I mean, aren't there pros out there? And I'm not disparaging you.
No,
I'm just saying this is a big deal. Maybe we should hire what's the
Public Strategies Group?
Yeah, something like that to advise us. These are difficult decisions. I'm not that smart. Maybe we should do that so that we can bring in all the people that we did and listen to them all. Didn't do a thing for us except it educated us. But where you can make the cuts, where they'll best be made, where we can do efficiencies, maybe we should bring in some pros to help us.
I think that there is opportunity in this year's budget, and I'm going to give you just one example, and that is we received an estimate from Danny Brown that we're paying $34 an hour to have lawns mowed, and that's not full costed. I think there are many ways that we can bring competition into government services and keep and/or improve services that we provide the citizens and save money at the same time. That being said, Dave, when do you anticipate that we will receive our budget books?
I think we're going to we'll probably publish them before the RMNA committee meeting. I'm expecting them to be in your hands before RMNA.
So next week.
I'm not sure exactly what day, but we'll be working on the weekend to try and get it all out.
All right.
That seems to be the only time we can work on it.
Commissioner Thomas and Commissioner Rennie?
Well, and the truth of the matter is, until we get that preliminary proposed budget, we're just talking now.
Well, what I've given you is an outline of the big issues.
Yeah.
I just kind of wanted to frame it for you, so when you get all the detail, you'll be able to at least see the bigger picture. And I really wanted to give you the opportunity to think about that and start to cogitate where we are.
Commissioner Rennie and Dr. Lathrop?
We had done a budget calendar that we approved here in the board. We were supposed to have some of this stuff in September, and then
September
a final
17th.
package, hopefully for approval by the end of October. Are we still on schedule?
Well, the September 17th deadline came and went.
Obviously, I'm talking about the end schedule.
But yeah, I think you can get it done by the end of October if you choose. But, like I said, the budget, the way it's presented is balanced and it allows for continuation of current services, so you can, fix the use of fund balance. You can reduce the use of fund balance at a later date. I mean, like after November 4th, you're going to know whether the surcharge is approved or not. So that'll be a big deal.
Doctor?
Somebody want to make a book on that?
I don't want to make a book on that.
I want the staff to know that I appreciate all the work you're doing. Any comments I've made tonight is not to disparage you guys. I know you're working real hard. This is a big problem.
Dean?
I just have one comment, and I generally try not to say too much, and Dave did a good job of framing the situation, but I hear a lot of talk about cuts. He provided other options. I think you all know how I feel about the pension bonds. I think that's something that we should consider in lieu of making drastic cuts to programs and services. Every day, the employees that I work with in this county are doing a good job to do more with less. That's from every employee, from the counter downstairs to the employees in the sheriff's office. They know the situation. They have all kinds of ideas, and they implement that every day that they come to work. So just to talk only about cuts, that kind of hurts just a little bit, because I think they're doing a lot already. Most employees have absorbed more in terms of their health, and, the health insurance that you provide. We don't have that with every group yet, but we're working on that. So, and Commissioner Maxbauer, thank you. There are ways to look at the services that we're providing, and competition may be an option. So let's consider everything and not just talk only of making cuts, because those have long-term consequences for not only for mostly the citizens of Grand Traverse County, which we all are.
Commissioner Lemkool.
I'd like to have us come prepared at our Ways and Means to look at whether or not we start the process for pension bonds. I think that's a real important issue in this situation. I also like to see us look at, Charlie hit it right on the head, we need to do a wage study for our employees. I think we all put that at the top of our list, and I really think that we need to have that put back in the budget so that we can start to go forward with that kind of a situation. Those two are the biggest issues that we have right now to deal with, and so whether or not we come and prepared and put that on our agenda to discuss those two particular issues, I'd like to see that happen.
Any additional comments before we move on? All right, unfinished business. We don't have any. This is our second opportunity for public comment. Dr. Johnson.
Bob Johnson, 2867 Voice Road, Kingsley. As I sit in the audience tonight, I kind of have some encouraging and discouraging. It seems like, almost sounds like we're glossing over sometimes on this budget, and I think we're in worse shape than what it sounds like. The pension obligation bonds really scare me. I encourage you to do a quick Google search on it. It has actually caused some towns to go bankrupt, because it's not as simple as it sounds. You have fluctuations of interest rates. Right now, at this time, with the rates being as low as they are, they're not going anywhere but up, which will reduce the value of that bond. So I highly encourage the current board to research that pension bonds before they take a lot of action on it. I've got, just before I came here today, Googled from the Center for State and Local Government Excellence from July of 2014, just a few months ago. They have a little study on it, on an update on pension bonds. They got a pro and con page on it. The pro, budget relief and cost savings. The downside is financial. The cost of your obligation could rise. The timing, depends on when the rates are. Interest rates right now, they're pretty low, and like I said, they can only go up. Flexibility. Once you roll into a bond, your flexibility's out the door. You will not have flexibility. That obligation is there for whatever length of that bond is. And then, again, I just encourage you to look at that and to research it. It's not as simple as just throwing a bond together. The other issues with cuts, I probably speak like everybody else here that we know that the employees are doing great work, and like the rest of the industry, less with more, or more with less. But it may come to where you have to do cuts. You may not have a choice. The big elephant in the room is capitals, improvements. There is no money right now set aside for anything. So, we've got a lot of infrastructure that needs work that's going to have to be funded at some point. So, I don't look forward to what you gentlemen have to do and ladies for the rest of the year. So good luck.
Thank you.
Thank you.
Thank you.
Greg Pash, 503 West 8th Street. The fund balance sometimes is like prestidigitation, financial prestidigitation, or it's like a shell game. Everybody focuses on the fund balance, but really the reason there is money in the fund balance is because the money wasn't being paid to MERS for the pension obligation. If we would have been paying what we were supposed to be paying, we would have nothing in the fund balance. So that's why we owe $40 million, is because the payments weren't made that were supposed to be made. We're in the bottom 13% in the state at being only 50% funded. It's because we didn't pay what we needed to pay. The reason I really object to the bonds, there's a lot of risk involved with them. And what it does is it moves the risk from MERS, which is an employee organization, to the taxpayer. And what MERS is doing, the way they're raising these rates, and trying to make up, I think they're trying to make up because their ratings are going to go down because they have to show these on their books. That's what I'm thinking. So basically what MERS is doing, which is an employee organization, it's basically extortion. And if you go and you look at what we'd end up paying the way they want us to pay, we would pay less with bonding it out over 20 years. But that's because they're being totally unreasonable on the payback rate, and I think that it really needs to be looked at whether there's some legal remedy or that we can say, well, this is what we're paying. That's it. And pay a reasonable amount so that it's paid off in a timely manner, but they shouldn't be able to like double the rate of payback. Thanks.
Any additional public comment?
Patrick Cudney, 5151 Hidden Gables Drive in Long Lake Township. 2 points. My first point is I was remiss in my report earlier to acknowledge someone who's here with me tonight when we talk about our annual reports. And this annual report looks very different than previous years. It's more concise, it feels better, it's more readable. That credit goes to Jenny McKellar, our Grand Traverse County Office Manager. It's now a model that we're using throughout the state, and she created this and developed this. I felt bad that I had forgot to mention that earlier. Now, as a citizen of Grand Traverse County and a taxpayer as well, as I continue to hear the county board talk about financial remedies to structural deficits and ways to deal with those and the opportunities and limitations that exist within those. Dr. Lathrop, I know you're exploring all opportunities and want to talk to professionals. And as a county citizen, my response is your professionals are sitting at the table with you. When we talk about consultants, you hired him a few years ago as your county administrator. Grand Traverse County is a bellwether county for northern Michigan. Other counties watch very closely the decisions you make and how you go about managing the resources that the taxpayers provide. The staff in this county are absolutely top-notch. I have nothing to gain by saying this. Dean Bott, Jen Seaman, Dave Benda, they are leaders within their field. As they make recommendations to you, they're making recommendations based on their experience, their best information. It all ends up what's being politically palatable and what you can accept as elected officials and what the taxpayers can elect you or re-elect you to make, depending on decisions that you ultimately make. Again, the political palatable route, I'm not sure what that is. I know I have my personal feelings. But as we look at structural deficits and we look at what's important, a basic level of service to county residents is what you all strive for. We are already at that. To go any further in cuts these county departments have received and given time and time again. We've looked at our budgets, all of us. I don't want to personalize this with our department because our budget is such a small piece. But what I'm asking you is to listen to your staff, listen to the opportunities that they present to you, consider other funding options, look at what's politically palatable, look at millages. What are taxpayers willing to fund? You have very, very difficult jobs. I very much appreciate the time and deliberation and effort you make in making these hard decisions. Thanks.
Thank you.
Thank you. Anyone else for public comment? All right. Moving on, Commissioner Committee reports. Commissioner Lemkool.
I think it's really important to note that I have the MERS report from the pavilions, so I'll be sharing that with Dean and Dave, and how much they're funded and unfunded, and how their different parts of their organization have to fund their retiree benefits. It's a very good report. I would hope that we might be able to get that kind of a report for our board for all of our different individual units that pay into this. I think this is a great report that they put together. And I think we did receive something like it, but I can't remember, but I will pass that on to them. And then also to let you know, the Pavilions is going to be doing some remodeling. They're doing a rehab unit in the Maple unit, so they're finding fewer and fewer people with dementia, but more and more people from Munson that need to have rehab. So they're trying to make some changes within their organization there to be able to handle that. Their financial picture is extremely good. They've done a great job over the years, and their board is very proud of what they're doing. I was not able to go to their meeting, but I did get their packet, and so I will be sharing that with Dave. The other thing I just wanted to bring up was the fact that we had a group of people last Saturday that went out to the Sand Lakes Quiet area and did some cleanup. Susan Shipman from our office led the way to be able to get that taken care of, along with Jim Hefner. And I'd just like to recognize those two and the work that they've done, but also the Road Commission stepped up to bring in a front-end loader and an operator to be able to do it. They figured it might take them a whole day to do it. With all the volunteers, and because the Road Commission was there, it spent less than a half a day that they got a complete site completely cleaned up. And it was one of the highest, worst use of trash in our community. We have numerous sites within our community. We're going to have to figure out how to do more collaboration and be able to get those taken and cleaned up. And we got to encourage the community, don't dump in our forest. It costs us money to be able to take that out of there. We have great resources to be able to get that stuff taken care of through our recycling. They said that a lot of the stuff that was out there could have been recycled, and it wasn't. I mean, it doesn't cost you anything to get something recycled. You throw it in the bin. But instead, these people are using it to be able to do that. They found that one guy apparently dumped a trailer. They don't know if they can go after it because now he's sitting in prison. So they know who it is, but there's no way for to get it back. But I really want to say thanks to Susan Shipman, Jim Hefner, and all the volunteers. They're going to ask me to sign a letter of thanks to all the volunteers, and also to Jim Cook and his staff for stepping up to the plate and be able to help us be able to help clean up a site. And it's very important to recognize those people.
All right. Commissioner Wheelock.
Well, just kind of segueing, segue must be the word tonight, you know.
Is that
adding to Herb's discussion here. I have asked Susie to come in next week at Physical Resources to speak to the cleanups. Earlier this week, the ticker put out by the Business News had a headline, Grand Traverse County is top dump site in Michigan. I could do without this personally, but I think one of the things that are interesting, and you know, I don't want to get into it too detailed because I want Susan to make the report next week. In 2011, we had 10 sites in Grand Traverse County that had been identified by the DNR as dump sites. Bob Oosterhout and Kim Elliott, myself, and a number of other volunteers used a lot of equipment and personnel and basically cleaned up every site that was on public land. You know, when we read this article, it talks about, you know, sites dating back to 2005. One of the problems that we had at that time was a number of the sites that were identified by the DNR were on private land. We had no authority by which to go in and remove those dumpings. So Susie will be here next week to talk about this a little bit. The state, the DNR has assigned a lady who deals with this. She is local in our community, and, you know, they are on top of this, and we are working at getting these sites cleaned up. But one of the things, when they talk about, you know, 45 identified sites, we're gonna find that many of those, first, when we did it before, there was a lot of the sites that they identified we couldn't find. We absolutely couldn't find them. They gave us addresses and longitudes and latitudes, and we simply could not find them. But a number of them were on private land. A number of them, we spoke to people, and they got them cleaned up, and then volunteers went and got a number of the other ones. So Susie will be here next week to give you a full report on that. But I just want the community to understand, this is not something that's just all of a sudden showed up and we haven't been addressing it. We take care of it annually and deal with it. You know, would it be nice if people didn't dump their trash on public land? Absolutely. But the fact is, it's not something we've ignored. We have been actively pursuing these cleanups every year, forever.
Dr. Lathrop.
I want to note that in the second time in a month, Commissioner Wheelock has worn a flowered shirt. And I really like it. In fact, I think we ought to have a meeting where we all just wear a flowered shirt, have a flowered shirt meeting.
Okay.
So, I like the tiger, we should all wear tiger shirts is what we should do.
I can do that.
Let's go do that.
I can do that.
Commissioner Rennie.
Doctor, I could do the tiger shirt, but I'm not into flowered shirts.
Okay, you do tiger?
Yeah.
Okay, I make a motion.
Notices and, I'm sorry.
I'm sorry, I had a commissioner.
Certainly, go ahead.
Attended a planning summit last night with our planning department, people from the state as well as our Traverse City planner and our county planner. Great meeting. Again, stressed the importance of going forward with collectivity and collaboration if we're going to get in line for any of these grants. They have basically said if these things don't show collaboration, they're going to reject the grant application immediately. It's something we have to look at. Now, getting back to these dumps, we have a household hazardous waste event this Saturday at the DPW garage on 113 in Kingsley. You have to make an appointment for that, but I would suggest anyone who's thinking about dumping something in the woods, take it to one of these events and get rid of it. It does not cost you anything.
Okay, notices and announcements, do we have any? Do we have a need for closed session?
We do not.
Madam Chairman, I'll make a motion to adjourn.
We're out.
All right. Nice job.